Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch presented by UMass Memorial Healthcare. Today we're talking about heel pain in runners. I'm here with Dr. Abhay Patel. So doctor, if my heel hurts when I run, do I just need new sneakers or is it a medical condition such as Achilles tendonitis or plantar fasciitis?
Heel pain is a really common complaint that we have in our clinic, one of the most common complaints we'll see. It is really common in runners, but other people too, also non-athletes as well. It could be a non-medical thing, but if it lasts for any kind of period of time, then most likely there is some medical explanation behind it.
What are the differences between Achilles tendonitis or plantar fasciitis?
They're actually different entities. They're related, but they're different entities. Your Achilles tendon comes from above here and inserts on your heel bone, and that, if it's inflamed, your Achilles tendon is what makes up Achilles tendonitis. But what, interestingly enough, on the bottom, you have your plantar fascia, which also connects to the heel bone as well. So in a way, both your Achilles tendon and your plantar fascia both connect to the same bone. And so the thinking is, at least with heel pain a lot, and again, it depends, of course, what's the source of it. If the pain is more on the bottom of the foot, it's often believed that a tightness in the calf muscle or the Achilles increases the strain of the plantar fascia. And that's why patients will have pain there in the bottom of the heel. And for that, we ask people to stretch. That's really the first mainline thing we'll ask people to do, runners or any regular people who are non-athletic, just to stretch and to try to take some of the strain off the bottom of the heel. If the pain is more in the back of the heel, then it may be due to the tendon itself being diseased, inflamed, or due to some sort of mechanical impingement. Over time, bone can grow from the back of the calcaneus and start abutting or hitting against the tendon, and that can cause a lot of pain as well, and that would be a more mechanical source. So we really got to ask when we see a patient, is your pain more on the bottom of your heel or in the back, and then we start thinking differently about the potential cause.
Who is susceptible to these problems?
As far as the plantar or bottom heel pain, that tends to be people with some just inherent tightness in their calf muscle and Achilles. I talked about a little earlier that those patients will have an increased strain on the bottom of the fascia. So if you are a person who's just really tight, needs to really stretch a lot to get loose, that's the kind of person that may get a higher susceptibility or more higher rate of having this plantar heel pain, or plantar fasciitis is what's called. As far as the pain in the back of the heel, that's going to be a person's forming a lot of bone in the back, and that is hard to say who's susceptible. Probably be a genetic link. As far as a person who, let's say maybe in their family, they've had a bunch of heel spurs in the back of their heel, that's going to be the patient that's going to have that problem.
How are these problems diagnosed?
The way they're diagnosed, and they're both differently diagnosed, is that the plantar fascia pain or the bottom heel pain is diagnosed with exam. So essentially, a patient will have tenderness or pain when you palpate the bottom of the heel right at the origin of the plantar fascia. That'll be their main complaint. And then that, along with the fact that with their knee in extension or straight, we try to bring the foot up to see passively how high we can bring the foot up. If they're not getting at least 10 degrees past the neutral position, that tells us that they have a lot of tightness in the calf muscle, or their Achilles tendon is tight. And that, we think, is how we predominantly diagnose it. We sometimes do studies like x-rays aren't particularly helpful for this problem, but sometimes we'll do an MRI, and with an MRI we'll see thickening of the plantar fascia. As far as Achilles tendonitis, that is the issue more in the back of the heel and also the Achilles tendon itself. We have a couple of ways to do it. Again, clinical exam is really important. We palpate the back of the heel or back of the tendon to see if there's a lot of thickening of the tendon. That's the first thing we may do. If it feels pretty thick, that may give us a rough idea that their Achilles tendon is chronically inflamed. If it's more in the bottom, but towards the back of the heel, a little lower down, but not purely the bottom of the heel, but lower down in the heel here in the back, then we'll palpate for bone spurs and see if there's anything abutting the tendon. The patient will complain of tenderness, if we palpate that area. We also have x-ray to confirm that as well.
What are some of the treatments for these conditions?
For the plantar fascia pain or the bottom of the foot pain we have in the heel, we're going to recommend a lot of stretching. That's the first mainline thing we do, and so we'll tell people to do long stretches for several times a day. That's the first thing we'll say. So it can be a little tedious. We're telling someone to stretch several times a day, maybe count to 5 with a long stretch of their foot, bringing it up 20 times or so. Just a lot of stretching throughout the day. Other things we can do, a cortisone injection, that can give some decrease of the inflammation to the area, and that can be more of a little bit of a short-term treatment. Sometimes it does work permanently, and we're fortunate, but we often can't count on that. So that is something we may will offer someone to give at least some short-term relief. And then lastly, what we do for this is we offer a surgical option for patients who have tried stretching, maybe physical therapy, injections, and they're just not getting a lot better, and they also happen to be having the tightness in the back of the Achilles that we talked about earlier. Then what we'll offer them to do is do a procedure called the Steuer procedure, which is we loosen up in the leg here, the calf muscle, the fascia or the covering of the calf muscle. We release it so the muscle can stretch, which allows the foot to go higher, and that'll decrease the strain in the heel.
Do you have any advice to runners to prevent these problems?
Definitely, I think there's a big role for anti-inflammatories with food, and that will help with some of the inflammation. Numerous types of Aleve, Motrin, Advil. I think they're all very helpful. That's one thing that'll decrease the inflammation, along with the stretching is the big thing to do, especially for the running population, to stretch several times a day. I think that's really important, and that will really help with a lot of the heel pain.